Hi, I'm Gabe.
I'm Kelly.
And I'm Jamie. What's up, Gabe?
I got a cold.
Mm-hmm.
Yeah.
Are you sure it's not allergies?
No, it's a cold because I hung out with my little nephew last weekend. And
Jam Factory.
He had like green snot trails.
Yep.
Mm-hmm.
And I was like wiping his nose with my own hanky, which then
that
means
is
a
sad.
hanky. So I was
Uh-huh.
asking for it.
You totally were asking
You
for
were the
it,
only
dude.
person I know that uses a hanky.
Well, I'm an old man. What do you want?
He
You're
really
not that
is.
old.
Yeah, see? I'm wearing a cardigan.
He wears a
Okay.
cardigan, he carries his pocket knife, and he has a hanky. He really is like a good old 75-year-old in a 30-something-year-old body.
I wear
Yes.
cardigans.
Okay. So moving into the discussion of the day.
Uh-huh.
We have two topics today. Do you want to start by explaining what happened in Toledo?
No, but I will.
Okay.
So although we got the transfer agreement from ProMedica and the clinic has now satisfied every legal requirement required by the Department of Health and Ohio law and everything else.
The clinic is Capital Care Network,
Yes.
Toledo's only remaining abortion clinic.
Yes. It got a notice from the Ohio Supreme Court. So the Supreme Court ruled, which is what got us to ProMedica giving the transfer agreement. So they ruled against the clinic a couple of months ago.
Right.
When that happened, the clinic actually filed a motion to reconsider, forcing the court to try again, basically.
Okay.
We pretty much knew it was a failed attempt, but you try everything you possibly can when you're in those situations. So the court ruled yesterday that they denied the motion to reconsider, basically ending all possible consideration of the case.
So technically this is a court with a different makeup than previously because now Bill O'Neill's no longer on it. So this is actually, for the first time in a while, an all Republican court made this decision.
Yes, it did.
Okay.
And there was no comment or no ruling. It was just denied and moved on. So although they have, like I said, fulfilled every legal requirement, they have temporarily been forced to stop performing surgical abortion procedures at that clinic in Toledo. So right now in Toledo, there's no place a person can go to get access to surgical abortion care in their community in Northwest Ohio.
But they are still performing medical abortions.
Yes.
Medication.
So you can still get a medication abortion at the clinic that goes through 9 weeks, 6 days. So through your 9th week of pregnancy.
Okay.
That's how long the FDA says it's effective for, and that's how long they go. And so you can still get access to that care there. And if you call that clinic, they can help you get access to services in other places, either their clinic in Columbus or there's a clinic right across the border in Michigan to get access to that care.
So this isn't just affecting people in Toledo. I mean, where were the patients coming from that this clinic served?
I mean, this clinic served a lot of people, not just a Northwest Ohio area, but also northeastern Indiana, because there's not a clinic up there. Whole Women's Health has actually been trying to reopen a clinic in South Bend and has been failing spectacularly because of Indiana's Department of Health, not for anything they're doing, but
it's basically still Mike Pence's administration rejecting it.
I mean, we think our Ohio Department of Health says ridiculous things, and then I go and read what Indiana said about the Whole Women's Health Clinic, and I just want to rip my eyes out because I can't believe I just read what I read.
Right.
So they served people from Indiana, from Ohio, from Southern Michigan. So they served patients from the whole tri-state area, really, in that clinic. So really that whole area of this part of the Midwest is really without an abortion provider right now.
And I mean, if there's a clinic closed in Toledo, that means those patients are going elsewhere. So there's gonna be longer appointment wait times in Columbus and in those clinics in Michigan as well.
Yeah, I mean, we saw that when the second to last clinic in Toledo closed, the Center for Choice in 2013. The statistics came out in 2014, and national statistics came out, and there were only 2 states in the entire country that year where the number of abortions increased. Those 2 states were Michigan and New Mexico. If we think about it for a second, Michigan was getting all the Ohio patients,
right?
And New Mexico is right next door to Texas, who was dealing with the same kind of things, actually to a much bigger degree with their House Bill 2 fight.
Right.
So, these 2 states that year that saw increases in abortion numbers were seeing those increases because people were coming across the border into those states to get access to that care.
Right. The abortion bans in each state didn't cause an actual decrease in abortions.
No.
And it certainly didn't cause a decrease in women seeking abortions.
Yeah.
They were just paying to travel
Mm-hmm.
to get the procedure.
Yeah.
If they could pay.
If they could pay. Something also critical for folks to know, if you are somebody in Northwest Ohio and need access to a surgical abortion procedure and can't afford to travel, need money for gas, need money for lodging, if you have to stay overnight, those kinds of things, there are funds both in Toledo and the state with the Agnes Reynolds Jackson Fund.
The Aggie Fund.
The Aggie Fund. And then Women Have Options, Ohio's statewide abortion fund, also has some money for those kinds of services as well. If you call the clinic that you're trying to go to get access to care, they should be able to help you figure out how to get access to that funding.
Okay. And so for people who are interested in helping, not seeking an abortion, but they just want to help, how can they get involved?
Well, in the show notes, we'll put links to both the Aggie Fund's Bowl-a-thon page and Women Have Options' Bowl-a-thon page. If you donate via that Bowl-a-thon page between now and April 30th, that donation is actually doubled. So all the money raised this week for the Bowl-a-thon, which happened in both of these places last weekend, but the fundraising continues through the end of the month. This last week of funding, all those donations are doubled. So your $10 donation becomes 20, your 50 becomes 100. So
what does that donation do, though?
that donation then provides access to care. So the money goes directly to patients needing access to abortion services to pay for the procedure or to go and travel to get access to the procedure they need.
So people can make a donation right now
Yes.
that will help someone pay for an abortion or get to a clinic
Yes.
to get the procedure.
Mm-hmm.
That's great.
Yes.
Okay. Do we have an idea on when services would be restored?
I think it really depends on how quickly the Department of Health acts.
Okay.
We have seen them take a while. We've seen them not take very long to do various things. So it really depends on how quickly they can get things rolling and approve the new license. Hopefully this is a couple of months, but we'll certainly let folks know if things look like it's going to be longer.
And we're waiting on the Ohio Department of Health.
Yes.
So can people contact the Department of Health?
Yes, they should totally contact the Department of Health. We'll put in the show notes both just the Director Lance Himes' email, but also a link to a form you can use through our system just to generate an email to him. And you can actually tweet at him. I think it's just at Lance Himes on Twitter. So you can tweet at him and tell him to move this application through the process quickly to minimize any impact to access to care in Northwest Ohio.
Light up his mentions.
You can start up a conversation about the calves.
Nice.
Mm-hmm.
So that's story number one. The Cavs. Did you watch the game last night?
No.
Did you see our boss's reaction?
No, I went to bed.
So LeBron hit the game-winning 3-point shot, and Kelly Copeland was the most excited person on Twitter. I mean, she really feels that LeBron is the core
coming
of her hometown pride. So we are officially a pro Cavs organization. So.
Is there another basketball team in the state?
No.
I mean, Ohio State, but not professional. And I kind of feel like I didn't actually watch the game live, but I was at the women's Final Four here in Columbus last month and earlier this month. God, it feels like it's been forever ago.
I know, right?
And there were 2 games where Notre Dame won with game-winning shot at the buzzer, and so knowing how that feels to watch your team go that hard, it's pretty impressive. So.
Notre Dame,
better than Mississippi State or UConn. I mean, come on.
Okay. Story number 2 is about. Did you know Hannah, our Northern Ohio organizer? Do you know she's a Yankees fan?
Isn't that the worst?
I did know that about her.
And you still hired her?
It's not as bad as being a Red Sox fan or a Patriots fan.
Yeah, that's true.
They're all really bad.
Yep.
Okay.
I can't really fault Yankees fans because my other half is also a semi-Yankees fan, although it was really just for a single player who's no longer there anymore. So I don't know how much of a Yankees fan she really is anymore. But
go Braves. I'm just the weirdest person in this office.
No, my soul requires me to root for the Reds because my entire extended family is from just north of Cincinnati, and I feel like my grandfather would come back and haunt me from the grave if I ever rooted for anyone else. Although
this is not the year for that.
No, well, it's never really the year for that. But I became a Cubs fan because again, my partner's really a Cubs fan.
The thing about being from the South is there's only one option for your baseball team for 5 of the states. There's no Alabama, Tennessee, South Carolina, North Carolina. There's only the Braves until you go to Florida. Florida, and who's going to do that? And there's like 5 teams.
Well, and yeah, I mean, you can have the whole argument of is Florida really the South anyway? So
The Panhandle, yes.
Yes. Mm-hmm.
I have had this argument.
Yes.
Yes, the Panhandle is.
Mm-hmm. It is most definitely. I will 100% agree with you on that one.
In South Carolina, is that what they teach you like in kindergarten is how to discuss whether or not Florida is?
I don't know. I didn't go to
South?
kindergarten in South Carolina.
Oh, okay.
I went to kindergarten in Georgia.
Oh. Okay. Well, same question.
What I learned Georgia history in 3rd and 8th grade, which is like when y'all learn Ohio history, I'm assuming.
Yes.
So I learned all about like the Trail of Tears and our state bird and Magnolia and Ray Charles.
And the War of Northern Aggression?
No, never called it that.
Really?
No, never actually heard it called it that. I also went to a very good public school system, though.
That's cool.
Shout out to
Fun legislative fact. If you ever get annoyed with all those ridiculous bills that are in the Ohio legislature, that's like the state amphibian or the state candy bar or the state sandwich. Those are all 4th graders learning how government works and talking to their legislator about how to introduce a bill and introducing a bill. So you can like blame all of the 4th grade teachers in Ohio for that fact.
Bless them.
Okay.
The Georgia state bird is the brown thrasher.
Way better than the cardinal, which is like the state bird of 500 other states. So
it was the name of our hockey team, and it's not a very intimidating bird, so it's funny.
It's really not, but
it's still a tiny little bird. Tweet, 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 tweet.
Okay, point number 2 on our agenda. Moving on. So what Mike DeWine do?
I mean, in general,
what didn't he do?
I mean, in general, he's DeWeeb, but
DeWine, more like DeWeeb.
Cracking ourselves up today. So last week's listeners heard about how the federal court ruled against the state of Ohio and supported the fact that Planned Parenthood should continue to get funding for 6 programs that Gabe will name in a minute. We said last week when we were talking about it that we were waiting for DeWine to decide whether or not he would appeal that ruling, and encouraged him to stop wasting taxpayer dollars on this stupid lawsuit. And shocker, guess what? He didn't listen to us. He must not be a NARAL's the Morning After listener.
Right.
And he should be. And on Monday or Tuesday, he announced that he was, in fact, going to appeal the federal court ruling that upheld that Planned Parenthood should continue to get these funds.
It must be nice to spend other people's money for your frivolous lawsuits.
Mm-hmm.
Right. So DeWine filing this appeal says that he does not want Planned Parenthood to get these funds. He doesn't want Planned Parenthood patients to benefit from these services.
It's not even just Planned Parenthood clinics, though.
Yeah.
It's any family planning clinic.
No, these are actually any place that provides or promotes abortion or contracts with somebody who provides or promotes abortion. So these actually includes hospitals. It would include anyone that worked with us because we would be promoting abortion.
But just any hospital that employed a doctor, if that doctor was providing referrals, that could trigger this funding ban.
Yes.
So like half the providers at Planned Parenthood are contracted. Well, actually, they're all contracted, but like they all have day jobs as like not abortion providers. So they're all like OB-GYNs or family practice. So like
any entity that they work for could be ineligible for these money. I mean, it's not like every state dollar and like Medicaid dollars and those kind of things. It's just these 6 programs.
This includes Ohio State, like the university hospital.
Yeah.
So the funds specifically blocked, I'll name them off, and if you want to talk about what each one does. The Violence Against Women Act.
So that actually is a specific program on rape prevention education. So all of that bystander education and those kinds of things on preventing people from becoming rapists. That's what that program is.
Mike DeWine doesn't want Planned Parenthood to help prevent rape.
Yes.
Okay. The Breast and Cervical Cancer Mortality Prevention Act.
So this was actually a program created in the 90s by the federal government that was looking at disproportionate mortality rates for breast and cervical cancer for low income and women of color. So they created this funding program for early detection and other screening programs to make sure that they're catching breast and cervical cancer early enough so that these people can be treated instead of die of these cancers.
Okay. Mike DeWine doesn't want to help stop breast and cervical cancer. Infertility Prevention Project.
So this is really funding for people who are thinking about getting pregnant. So a lot of these are actually what we call reproductive health life plans, which are really a kind of interesting way of thinking about. So I want to get pregnant at some point, not right now. So right now I do X, Y, and Z to not get pregnant, but in the future, a year before I want to get pregnant, I should probably start taking folic acid and prenatal vitamins. And so how do you become a healthy person by kind of setting yourself up for success? And then what can you do to limit infertility issues?
So Mike DeWine doesn't want Planned Parenthood to
help people.
Planned Parenthood?
Planned Parenthood, yes, pretty much.
What? The Minority HIV/AIDS Initiative.
So this is actually paying for testing for HIV tests in the minority communities around the state.
So Mike DeWine is okay with Black people not having access to HIV tests?
Yes.
Okay. Infant Mortality Reduction Initiative.
So this is mostly a program out of Youngstown for Planned Parenthood. It's a statewide program, but Planned Parenthood pretty much primarily does it in the Mahoning Valley. It's called Moms to Be, and it's a program for women while they're pregnant and then in the first year of their child's life to make sure that they have a healthy pregnancy and that the child is as healthy as possible to reduce infant mortality rates.
Okay.
Which Ohio has a big problem with.
Yes, it does. Shocker. And
Right.
we're just going to take that money away and just decrease that program.
We're
Right.
going to take it away from like the most recognized brand in reproductive health.
Well, I think the biggest thing with all of these programs, and it's something that we haven't talked about in a while, but is so important to know, is that all of these are competitive grant programs. So that Moms to Be program continues to get funding every 5 years or whatever the funding cycle is from the Department of Health, because when Planned Parenthood applies for it, tells them about the program, they are the best people to serve the most people for the least amount of money.
Right.
So yeah, there might be somebody else that runs a program out there, but they're not going to be as effective and efficient as Planned Parenthood is. So they're not going to serve as many people. They're going to spend more money doing it. So why shouldn't we be looking at the most effective, most efficient programs to do what these programs do?
Right.
I mean, it's
Instead
not
of
like we're
helping-
just willy-nilly saying, oh, here's Planned Parenthood, we're just going to give you all this money. They compete for this money against other people, and they are granted the grants because they are the best.
Right. Instead of helping prevent infant mortality, Mike DeWine is taking funds away from the people who can
Yes.
do the work to help people.
Luckily, there's a court to stop him from doing that, but yes, that's his goal.
The last one I've heard referred to as PrEP. It's the
Mhm.
Personal Responsibility Education Program. What's that?
Yeah, so this is actually a sex ed program. It was started in the Obama administration, actually. And it is a sex ed program specifically targeting youth in the foster system and youth in the juvenile justice system. So two very high risk, at risk populations for STDs and unintended pregnancy and those kinds of things, making sure that they have the information to not get pregnant when they don't want to be, and to prevent the spread of sexually transmitted infections.
So you're saying kids in foster care, kids in juvenile detention, those are both populations where they don't have access to their parents to give
Yes.
them good guidance.
Yeah.
And so this would be a program to teach them how to make smart decisions.
Mhm.
Mike DeWine doesn't want them to have access to this
Yes.
curriculum.
Again, yes.
Okay. So he is, again, filing an appeal to reverse what was a unanimous federal court decision from the Sixth Circuit.
Mhm.
They said, no, Planned Parenthood should have access to this money. John Kasich's defunding bill is unconstitutional.
Yeah. And I think actually it's kind of not funny, but ironic funny. When we hear about all the antis who protest outside the clinic, and we start talking about clinic protection bills and those kinds of things, they always scream, it's my First Amendment rights. You can't violate my First Amendment rights. Well, this is exactly the argument Planned Parenthood is using. If you're saying I can't get access to this money because I said these things over here, I promoted abortion, I told somebody how to get it, I provided abortion care, that they're violating our First Amendment rights to free speech.
Right.
So, if it works for you, it works both ways. So everybody has their First Amendment right to free speech. And that's really one of the main reasons the courts came down on that side. And I
Okay.
think it's hilarious because you say it was a unanimous decision. It's like when they do the federal courts, that first level is like a section of the federal bench. and it was unanimous in that section.
Yes.
Yesterday, the executive director of Ohio Right to Life tweeted that he was really excited that Mike DeWine was appealing the case because when it went to the full bench, they were going to win. And I'm like, if a randomly selected subgroup that included Bush appointees,
Right.
actually, I think Bush and Reagan appointees, I think it had two Republican judges and a Democratic judge. I think
This is not a liberal bench.
No, this is not a liberal bench. I mean, this is the Sixth Circuit. This is the circuit that said, "Oh yeah, gay people not being allowed to marry is totally constitutional. What are all these states' problems?" This is that same court, not a liberal court. So, Mike Konadakis from Ohio Right to Life is on some like alternate planet universe where he thinks that, going to the full bench, they're going to magically win when they're just not going to.
I mean, we have a lot of issues with Mike Konadakis in general.
Yeah.
So,
yeah.
And I'm not surprised we don't agree with him on this.
Yeah. No. Fundamental disagreement.
So this one being a case in the federal courts, there isn't really a way for people to get involved in the case.
No.
It's just in the courts. But we can start talking about why Mike DeWine is doing what he's doing, the damage that his anti-abortion agenda will cause by targeting these other funds and all the different patients and clients that it would impact.
Yes. And why he most certainly should not be the next governor of the state of Ohio.
Unfit to lead. Okay.
More like DeWeeb.
It is kind of a fun.
So continuing talking about court cases and their impact, the state of Indiana has a Down syndrome abortion ban that's basically the same. It's wrapped up with other legislation in an omnibus bill, but it's basically that part of that bill is the same thing as what Ohio's passed. Their Down syndrome abortion ban got blocked by now a second federal court in Indiana. So their governor appealed to the next level, and that got struck down. So now we've seen, using Indiana as an example, it is twice unconstitutional. So as Ohio's case continues, as being pushed by the ACLU and several of our clinics, we have this crystal clear example of why this idea is still unconstitutional. Yeah.
I mean, there's really not a whole lot more to say about that. I mean,
we've talked about this a lot.
Yeah.
Although, what is omnibus?
A bill with several things.
Oh yeah, because they had their Down syndrome and fetal tissue remains in the same bill.
Yeah.
Whereas Ohio's tries to do it in two.
Right. It was a really nasty, just lump everything together.
Yeah. Texas's House Bill 2 was also an omnibus abortion bill.
Oh, okay, cool.
They just shove them all into one.
Yeah.
We'll probably see some.
It sounds efficient.
we also in lame duck like to call these same bills Christmas tree bills.
Oh, good.
Because people like this Christmas tree is up and ready, and so I'm going to hang my ornament on it too because I want to get my piece in it too.
Right.
So, yeah, Christmas tree bills.
There's nothing much more to say, but that decision by the Indiana courts came down this week. What also came down in the past 2 weeks that we didn't talk about was the state of Kentucky has a bill similar to our abortion method ban that was blocked. So we've got, 2 states neighboring Ohio with federal courts saying, hey, these abortion restrictions that your legislature has been pushing forward are unconstitutional. You cannot do these. We're stopping them, we're blocking them, we're putting on hold. And so that should be a clear message to state legislators that the things that they're considering are bad ideas. So
you would think. But then we, introduce things like, total abortion bans that, execute women. So,
right.
Yeah.
Handmaid's Tale season 2 dropped.
Yes, it did.
It's just relevant.
I still have yet to see that show.
The first season?
Yeah.
You were part of the... Okay.
I don't have Hulu, so...
You're welcome to borrow mine.
Oh, okay. Nice.
Yeah, so, I mean, we'll see what happens. I mean, our D&E ban is still sitting in committee. And thankfully, our legislature takes a nice little break before election days. So
it's almost like they don't want to stir up any stuff before they have to go to the polls.
Yeah, usually they like to stir up a little stuff before primary day because they all are
Pay
trying
attention to me.
out conservative each other, which is evidenced by what I'm watching on my television screen right now.
Right.
But I'm like Trump. No, I'm like Trump. But they we'll see when they come back. They come back like the 15th of May. We'll see if the D&E ban moves or if the fetal tissue bill has been waiting for a floor vote in the House moves.
I'm not pregnant this summer.
That's nice.
Okay, so in news that broke just this morning before we sat down to record, Bill Cosby's been convicted, guilty on all charges. So that's good.
Finally,
He doesn't have a plane.
Yeah, I guess the prosecutor wanted them to like hold him immediately because he has access to a private plane and could travel anywhere in the world. And like, I guess he like Cosby screamed in the courtroom that he doesn't have a private plane.
Oh, I didn't hear that.
Yeah, it was some reporter tweeted it. It was in the NPR article I was reading about it. So obviously he was really excited about being found guilty. I was like, I feel like saying, no, I don't, just kind of proves that you were already thinking about that.
Right.
I just want to give a shout out and a thanks to Hannibal Buress for bringing this all to light. Who would have thought that stand-up comedy could change the world?
Nice.
I know some comics that would probably like to change the world. I would like them to change the world too.
I don't know if they're going to do it on stage though.
Probably not. But
Did you see this morning Trump called into Fox and Friends and ranted for a full 30 minutes?
I heard a portion of it. They replayed
Full
it
half
on
hour.
MSNBC this morning, and I was listening on my drive-in this morning. And
how can you even defend that if you are on Fox and Friends? You're just like, I got to deal with the president who's just yelling at me for half an hour.
Oh, they were sitting there on the couch and like awkwardly trying to like cut in and say, but Mr. President, that trying to ask him questions, and it was just like a locomotive of crazy, just steaming straight through with this stream of consciousness for 30 minutes.
I'm so uncomfortable.
So was everybody watching.
Yeah, I didn't actually see it, but I was listening to it on the radio, and you could hear they were trying to break in with, but and they like seriously would get a word and a half in, and he would just keep right on.
So what was the topic of like what was the topic?
All of them.
All of the topics.
Yeah.
But he's gonna take over the Justice Department, but he's gonna wait until after this whole Russia thing's over.
He thought that if cooler heads weren't going to prevail, that we would have went to North Korea or nuclear war with North Korea. Nuclear war with North Korea. Yeah.
You're definitely a product of the Bush years.
Sorry. Yeah, I mean, just he talked about everything, and you got to watch the video because he phoned in. The only camera shot they had is just the host, and they're sitting there on that weird couch, just like,
I hate it.
Nervous.
I hate it.
They kind of deserve that. I mean, they let him on the air and they thought that he wasn't just going to rant for a half an hour. I mean,
they deserve this for so many reasons.
Has a president ever just called into a news show? I'm just so baffled by this.
I'm sure it was like set up and they thought, oh, we'll have him talk for 2 to 5 minutes, but then he just
what is the breaking point for this presidency? I don't understand.
Everybody's praying we find out.
I doubt it exists.
Nobody gets killed.
I doubt it exists.
Mm-hmm.
No, it was funny. I was at the Indigo Girls concert a couple weeks ago, and one of their songs is about not dying in a nuclear war, and it just kind of went, huh? Yeah.
Don't you love it when things are perennially relevant?
Because it was definitely a song written probably in the late 80s, early 90s, when like nuclear showdown was much more likely.
You can't hug kids with nuclear arms.
Yes. And all of that stuff is most definitely coming right back again.
Nuclear. You want to talk about Minnesota's basketball team?
Sure.
I guess we already talked about some basketball.
We did talk about some basketball. I was just really excited because one of my favorite players, Lindsay Whalen, was named recently the new head coach of the Minnesota women's basketball team, which is very exciting and very cool. She's young. And it was actually interesting. I was listening to another one of my favorite podcasts, Burn It Down, which Gabe turned me on to.
Podcast recently. Recommendation. We'll put a link to that.
Yes. Feminist sports. You really can't beat it. They had a whole show about Kobe's complex relationship with women's basketball, which was fabulous. But they were talking about how Title IX, which guarantees equality and access to education and sports for girls.
So this is University of Minnesota coach.
Yes. Okay. University of Minnesota. And but she actually also plays on the Minnesota WNBA team, the Lynx, and I think she'll be the second only player to actually coach and actively play at the same time. Dawn Staley was the other one who coaches for South Carolina. Go Gamecocks. And if they had made it to the Final Four, I would have totally rooted for them. But
I'm really sad they didn't, because I was excited for them, like for the Final Four to be in Columbus. I was like, I can go see them. I can't go see them.
But yeah, so one of the things that they were talking about on that other podcast was that Title IX really increased access to women's sports in general, like as players. But when you look at the number of coaches, when Title IX was actually put out, 80% of coaches were female. 80% of women's basketball coaches were female. And that number is a much, much smaller percentage nowadays. Notre Dame, actually, one of the reasons I like them is that they have a female head coach, but they also have an all-woman coaching staff. Every member of their coaching staff is a woman. And they're one of the very, very few schools that did it. She was actually Muffet McGraw was the only women's coach in the Final Four. The other three teams all were coached by men.
Boo.
So it's just really excited to see a young woman like Lindsay taking the helm at Minnesota, another Big Ten school. So go Big Ten. And we'll see what wonderful things she does there.
Okay.
Yay.
What's coming up in the event calendar?
I don't know, but I don't want to say that there can't be aliens, because if there were, then Donald Trump would have told us. Just wanted to share that thought.
Probably true.
I'm disappointed. That was my biggest fear. Well, I guess I'm not disappointed. I'm relieved, because it was my biggest fear as a kid of being abducted by aliens. I watched too many shows like that on the History Channel.
Okay.
What's coming up?
You and Dennis Kucinich.
No comment. So upcoming events include, well, there's a compassionate care training this weekend in Cincinnati, today and tomorrow in Cincinnati with RCRC.
I don't have that one on our thing.
Oh, it should be. My bad.
No, that's my fault.
I do my best to go behind you and do what you don't do.
Yeah.
April 30th is coming Monday. We have a Columbus electoral phone bank. Beltane is May 1st. That's all I care about until Tuesday.
So the phone bank, how can people sign up to volunteer?
You can go to our Facebook. You can otherwise email me, Kelly, KELLEYF, as in Freeman, at prochoiceohio.org. Because I know people don't use Facebook, but you can find out the information if you email me. And then we have one in Dayton that'll be May 7th. So that'll be fun.
Between now and then,
It's fine.
May 1st is
Beltane. Labor Day. Actual Labor Day.
Okay.
I'm done.
May 1st up in Cleveland at the Bottle House is an event called the Story Club East Side Spring Break.
Oh yeah, that's a fundraiser for NARAL.
Yes.
It's like an open mic, and you can like hear stories that are spring break themed. Mallory McMaster, our C4 board chair, is going to be there telling stories.
Yes.
Cool.
So look for that one in the show notes. And then May 6th is the next Crafternoon.
Oh yeah. We're going to be making stencils.
Stencils.
Pro-choice stencils for spray chalk or spray paint. I don't know. I'm not going to tell you what to do with your stencil after you leave them.
Oh, okay. I just didn't know if there was a afterward use for said stencils.
Not specifically.
Okay, cool.
But I mean, not planned.
They could be very fun for spray chalking outside of the clinic, because spray chalk lasts way longer than regular chalking.
You do realize people we don't like listen to this, right?
Yeah, I know.
May 7th.
I've got a power washer. I can take care of it.
Crafternoon is at Holy Craft.
Yes.
May 7th is the next. That was your Dayton phone bank.
Yes.
At the Westwood Branch Library.
And in Dayton, apparently that's a recently renovated branch, so it's going to be pretty nice to show up.
Cool.
May 8th is primary day, so vote.
We'll be calling Niraj Antani's for Niraj Antani's opponent that day. So you should really come out and go to that phone bank.
Yep.
May 8th, the evening of May 8th. So after the polls are closed.
Stand up for choice.
Which
benefits Roots.
Yeah.
So, it's their 2-year anniversary show, right?
Yes, it is.
Nice.
I'm not on the show.
Do you know who the comedians are that are on the
I know Bianca Moore is. She's a local comic. I know that there's somebody from DC, Catherine Jessup, I think is her name. And I don't remember off the top of my head who else is on it.
Cool. Okay. And then the last thing that's on our event calendar I want to mention, our friends at Lady Parts Justice are going to be back. They're going to have a show in Columbus at the Ace of Cups June 24th, which is the evening the Sunday of Comfest.
Yes, the Magical Mystery Tour.
So after you get done with Comfest, head up to Ace of Cups and get to.
There'll be a comedy show, and then there'll be a talk back.
Yes.
With a clinic worker and maybe me. I don't know.
Nice.
Cool.
Yeah, we'll see.
That'll be good.
And
Okay.
I think they're going to do a thing at the solar stage too during Comfest.
Yep.
Nice.
You can probably meet some of their staff at our FOCO booth.
Cool.
It'll be fabulous.
I will be at Cincy Pride that day.
Yeah.
So link for the event calendar is in the show notes, so everybody can see the stuff and sign up. Anything else?
Don't think so.
Okay. We'll see everybody next week.
Bye.
Bye.